You are tuning in to Living Mentally Well with Kevin Hines. Follow us as we interview some of the greatest, most influential minds and public figures in the fields of suicide prevention, entertainment, activism, mental and behavioral health. We welcome you to listen, learn, watch, and enjoy. All of this is brought to you by 17th and Montgomery Productions. My vision after finding the ability to live mentally well most days.
I am a partner in a firm called Change Matrix, and we are a partnership of 4 women who all work in the field of health and mental health around the country at the national level, the state level, and the local level. And we work to build systems that promote health and mental health and prevent things from getting harder, and we work on service array for treatment.
And you work with Kendrick-Burk?
And I work with Kendrick-Burk.
And she's a good friend?
She is my partner.
High five, we just high fived. Okay. All right, now I want to ask you a couple of questions about your work in the field. Can you highlight something that you're doing that's very specific at the Change Matrix?
Yes, I can. Can I do 2?
You can do 2.
Okay.
We have time for 2.
We have time for 2. On the national level, we are part of the Now is the Time Technical Assistance Center. And so Now is the Time has 2 strands to it. One of them is Project Aware, which is very invested in incorporating mental health into school systems because that's where kids are. So we're thinking about how to create more access and availability to mental health services and supports for the 10 grantee states for Project Aware. And in Healthy Transitions, we're supporting states and local areas who are interested in creating more comprehensive systems for young people as they transition to adulthood. And so that means more than mental health. In addition to mental health, it means housing, it means jobs, it means financing, it means all sorts of things that help us have productive and healthy adulthood. So that's a national program that we work in. We all have states that we visit. And then on the local level, I'm helping to coordinate a trauma-informed system of care in St. Joseph County, Indiana. And so we're very interested in making sure that all of our system partners come together under this principled approach so that we all understand trauma principles, and every interaction we have with any child in our community is trauma-informed and not harmful.
Oh, I love that. It's amazing.
Yay, I'm so excited.
Yes. Okay. That said, what do the words mental health mean to you?
I'm so glad you asked that question because we wrestle with this term in this field because of the stigma, because of the preconceived notions of what mental health means. And I've checked my kids as they talk about things like he's crazy or insane. And we think about that language as it relates to mental health. And in fact, I think the larger community thinks about mental health as illness. And we want to embrace health as an essential component of health. So when I think about mental health, I think about the ability to get up when you've fallen, because we all fall, right? We all stumble. But do you have enough to ask for help? Do you have enough to get up on your own? And what does it take to help you get back up? I actually think about those BOSU balls, those half balls that you exercise on. There's no way you're going to stand up.
No, you're going to fall.
You're going to fall.
Yeah.
But can you get back up? That's mental health.
Can you get back up and keep going? Yes, you can.
Yes, you can.
Okay. Liz, what is one thing you do every single day for your personal well-being?
I do 2 things.
Okay.
I run or exercise every day because I'm a little hyperactive, and I try to eat 3 really balanced, healthy meals of vegetables and fruits and whole grains and things like that, and it really does make a difference. I feel calmer and more well when I take care of my physical health as well as my mental health.
Physical and mental put together equals better. Eat your vegetables.
Yes.
This has been Living Mentally Well with Kevin Hines and Liz
Waetzig.
Waetzig. I forgot how to pronounce it. Good. Let's retake that.
No.
No?
No, it's fine.
We're leaving it.
It's funny. It's
Liz
good.
Waetzig. Here she is.
Yay.
There
Kevin
she
Hines,
goes.
here he is.
Thank you very much. This has been Living Mentally Well with Kevin Hines, brought to you by 17th and Montgomery Productions. Thank you for tuning in. Subscribe below and let us know the thoughts you have in the comment section. Everyone has a story. We want to hear yours because you matter.